next topic or the next portion, what is left out is the pathogenesis and the lab diagnosis of Schistosoma haematobium. So this will be the part 2 of the video. Okay, so we have the pathogenesis or pathogenicity and clinical features. Here, clinical illness caused by Schistosoma or schistosomes can be classified depending on the stages in the evolution of the infection, which includes like skin penetration and incubation period, egg deposition and extrusion, then tissue proliferation and repair. And the clinical features during the incubation period may be local cercarial dermatitis or general anaphylactic or toxic symptoms. Okay, so this cercarial dermatitis consists of transient itching and petechial lesions at the site of entry of the cercary, or we also call it swimmer's itch. This is seen more often in visitors to endemic areas than in locals who may be immune due to repeated contacts. Okay, so it is particularly severe when the infection occurs with cercary of non-human schistosomes, and the anaphylactic or toxic symptoms include fever, headache, malaise, and urticaria. So these are the few symptoms under anaphylactic or toxic symptoms. Then this is accompanied by leukocytosis, eosinophilia, enlarged tender liver, and a palpable spleen. This condition is more common in infection with the case of Schistosoma japonicum. Okay, we have another species, that is Schistosoma japonicum. So mostly this condition like leukocytosis, eosinophilia, enlarged tender liver, and palpable spleen, these are more common in infection caused by the Schistosoma japonicum. Okay, or we also call it as a Katayama fever. So the clinical features during oviposition include painless terminal hematuria or endemic hematuria. This hematuria is initially microscopic but becomes gross if infection is heavy, and most of the patients develop frequency of micturition and burning. So cytoscopy shows hyperplasia and inflammation of bladder mucosa with minute papillary or vesicular lesions. Then during tissue proliferation and repair, what are the clinical features? So in tissue proliferation and repair, in case of chronic stage, there is generalized hyperplasia and fibrosis of the vesical mucosa with a granular appearance or sandy patch. Okay, then at the site of deposition of the eggs, you will see dense infiltration with lymphocytes, plasma cells, and eosinophils, which leads to pseudoabscess or pseudoabscesses. Then initially the trigone is involved, but ultimately the entire mucosa becomes inflamed, thick, and ulcerated, and secondary bacterial infection will lead to chronic cystitis. Okay, then calculi or calculi form in the bladder due to deposition of oxalate and uric acid crystals around the eggs and blood clots. Then you will see sometimes there may be obstructive hyperplasia of the ureters and urethra, or we also call it hydroureter. Then the chronic schistosomiasis has been associated with squamous cell carcinoma of the bladder. Such malignancy is detected in a younger age group as compared to transitional cell carcinoma of the bladder. And in fact, this Schistosoma haematobium is now classified as a human carcinogen. So significant disease may occur in other organs during schistosomiasis. Okay. Then out here, lungs and central nervous system or the spinal cord, skin and genital organs may be involved in this significant disease, which includes other organs. You will see ectopic lesions in the spinal cord produce a transverse myelitis-like syndrome. Okay, then this schistosomiasis favors urinary carriage of typhoid bacilli. So that's all about the pathogenesis and clinical features of Schistosoma haematobium. Then coming up next we have is the lab diagnosis of Schistosoma haematobium. So here it is divided into different categories, or you can perform different methods for detecting the parasite. For the detection or demonstration of Schistosoma haematobium, you can perform demonstration of characteristic like detection of antigens, detection of antibody, and intradermal skin tests, as well as imaging. So these are the different methods where we can perform to detect the parasite Schistosoma haematobium. So under the first category, that is detection or demonstration of characteristic egg, here we have urine microscopy. So here the eggs with characteristic terminal spines can be demonstrated by microscopic examination of centrifuge deposits of urine, or by filtration of a known volume of urine through nucleopore filters. Then the eggs are more abundant in the blood and passed by patients at the end of the micturition. Then you will see nucleopore filtration methods provides quantitative data on the intensity of infection, which is of value in assessing the degree of tissue damage and in monitoring the effect of chemotherapy. Then the eggs can also be seen in seminal fluid in males, in case of males. So that is for the urine microscopy. Then we have histopathology. Out here, schistosome infection may be diagnosed by demonstrating its eggs in bladder mucosal biopsy. We can collect the bladder mucosal biopsy. Then detection of antigen. This is another diagnostic method for detection of specific schistosome antigens in serum or urine. Out here, 2 glycoprotein antigens associated with the gut of adult schistosomes circulating. There is a circulating anodic antigen or CAA and circulating cathodic antigens CCA. These two can be demonstrated by ELISA using monoclonal antibodies, and the test is very sensitive and specific by this method, but it is available only in specialized labs. That is for the detection of antigen. Coming to the next part, we have is detection of antibody. So out here, several serological tests have been described for detection of specific antibody, but they are not very useful as they cannot differentiate between present and past infection. This includes CFT or complement fixation test, then bentonite flocculation test, IHA, indirect hem agglutination, then immunofluorescence and gel diffusion tests. So these are the few serological tests mentioned here. Then we have 2 serological tests available at Centers for Disease Control and Prevention, CDC. They are the Falcon assay screening tests, or we call it FAST, ELISA, and the confirmatory enzyme link immunoelectrotransfer blot, EITB. Enzyme link immunoelectrotransfer blot. Both these methods or these tests are highly sensitive and specific, around 95% sensitive and 99% specific. So in ELISA test, the Schistosoma haematobium adult worm microsomal antigen, or we call it HAMA, okay, for microsomal antigen, is used for the detection of specific antibody. So that's all about the detection of antibody. Coming to the intradermal skin test, or we also call it Fairley's test. Okay, so here skin tests are group specific and give positive results in all the schistosomiasis. The intradermal allergic tests use antigen from infected snails, cercari, eggs, and adult schistosomes for experimentally infected laboratory animals. So that is for the case of Fairley's test or intradermal skin test. Okay, then we have the next is the imaging. Here you can perform X-ray of the abdomen. This may show bladder and ureteral calcification. Then USG can also be performed. Ultrasonography. This is also useful in diagnosing Schistosoma haematobium infection. And this USG may also show hydroureter and hydronephrosis. And IVP can also perform, that is intravenous pyelogram, and cystoscopy are also useful in indirect diagnosis of the disease caused by this parasite. So that's all about the lab diagnosis of Schistosoma haematobium. So in treatment we have praziquantel, which is the drug of choice, and we have metrophenate. This is the alternative drug of choice in case if the person is suffering from schistosomiasis, okay, which is caused by the Schistosoma haematobium. Then the prophylaxis, or what are the prevention that can be taken. So the prophylactic measures includes eradication of the intermediate molluscan host, then prevention of environmental pollution with urine and feces, then effective treatment of infected persons, and we need to avoid swimming, bathing, and washing in infected water. So that's all about Schistosoma haematobium.